Hello, I'm Jill Lay. I'm Senior Editor with CTSNet for Allied Health, and I'm delighted to be here today with Richard Van Balen and Christina Ruiz-Segura to talk about an exciting new fellowship opportunity of interest to our non-physician members. Can you please tell us a little bit about the fellowship, what its objectives are, and how it came about?
Thanks for giving this opportunity for us to talk today here in CTSNet. So we're so excited because we have this opportunity that we kind of create in the last few months, and is an opportunity in the association of EACTS, in European Association for Cardiothoracic, as you know, and it's just to have a place for nursing to kind of travel and embrace their professional portfolio. So the idea is to create these travel fellowships. So any fellows, any nursing and health professionals, they can travel to another centers where they have other roles or more advanced roles, and they can learn, and also they can learn what is on the background, all this academia that always have these advanced roles. So we are so excited. And I believe this is very unique and original. So it normally tends to be for doctors, and this year it's for nurses as well, and other health professionals.
So this sounds like it's a professional fellowship opportunity for allied health professionals exclusively to go and immerse themselves in another environment to learn from that center. Richard, could you expand on what the qualifications might be for the successful applicant and a timeline of what might happen moving forward?
Together with Christina, we worked very hard to make this possible. We've defined it as giving nurses and allied health professionals, providers, the opportunity to improve their skills, to network, and to grow as a professional and take that back to their own center or their own country. And to make that possible, it's important to realize that funding for nurses and allied health providers can be challenging. So we're very happy that the European Association of Cardiothoracic Surgery, together with AtriCure, have made it possible for the fellow to do a 3-week visit to a center of excellence. And what we will do for them is that we will help them in liaising with that center. There will be a grant of a little more than 5,000 euros to make sure that you can go to that country, that you can go to that center, that you have an hotel and things like that. So we really want to make it possible for somebody to go abroad, to learn, to take back to their own country, and to really become a role model for others. I recently helped write an editorial for the research network that's called Connect, and we looked into options for nurses and allied health professionals to do things like that, and it does not exist. This is the first opportunity for people to do this, and we'll make sure that you have funding. We'll make sure that you have our backup and the backup of the biggest society of cardiothoracic surgery. And we really want this to be a success.
This is just so exciting. You're right. Nothing like this has ever existed before. And it's wonderful that EACTS is sponsoring this. I believe EACTS membership is part of the application process. So I'm wondering, Christina, if you could tell me just a little bit about membership in EACTS, what that might entail, and why what that would be, part of this opportunity for the potential candidates.
So the membership this year, the price has been reduced to only £50. So I think it's a fantastic opportunity to become member of a society like that. And you've got all the benefits that any other memberships, any other surgeons, doctors, medical students, they have. Even now that you can access to all the webinars. There is the opportunity to learn lots and to connect with other centers and other people, which is probably, this is the most important part. You need to know how they work in other places. And as you know, in Europe, the professionals, they have different, there's a broad variety of roles, responsibilities, and probably numbers. They are quite interesting if you are a professional with a lot that you want to do and you want to go this extra mile. So I think it's a fantastic opportunity. And we're hoping in the next following year, in 2025, to have some webinars that they will be focused on nursing and health professionals for our group. So it's a lot of things that we're working on, lots of exciting things that are going to happen in the next couple of years. So be a member. I think it will be fantastic. Apart from be as well to be part in the annual meeting and come and meet us or meet other people with probably the same problems or the same things that they want to change.
When I hear things like this, I instantly think that this is appealing towards academia, and that, you know, nurses that have already done research are the likely ones to apply. But I understand that you're trying to really attract others and get more of a groundswell, if you will. Christina, if you wouldn't mind expanding a little bit more about the types of allied health professionals that you're hoping to attract with this, maybe, you know, those involved in quality assurance, what types of a candidate qualifications would you suggest are needed?
Basically, it's any professional who works in the cardiothoracic environment, deals with patients, that they see that other places, they have different pathways and they have different things to do, different ways of working, and they want to experiment that. Of course, we're asking for someone who is gonna go into this fellowship that has a background. So someone who's been working in the area and know the type of patient, the type of surgeries, and the type of recoveries, pre, post. We're not aiming for someone who is super academic, that has done a lot of research, maybe someone who wants to do it, but they don't have the tools, the abilities, the possibilities, the center, they don't have that, and they want to do that. I think it's for anyone who is motivated, you know, we're gonna help you, we're gonna support you, and we want you to have the best of this travel.
That sounds wonderful. And again, I really like the idea that it's open to all, and really anyone with a good idea and motivation to get connected and to really work hard at a particular problem would be an appropriate candidate and should look into applying. Richard, is there anything else that you can tell us? Obviously, we want the specifics of when and how to apply, but anything else you'd like to add before we close?
We want somebody who has a little bit of background, who is a little bit of a seasoned healthcare provider and really wants to broaden their view on healthcare. And it's important to know that this fellowship will start from January of 2025. So we need you to be available to do your fellowship in that period. And even more important, that you turn in your application on time. So you have a month from now to get the application in order, and then we're very happy to meet all those enthusiastic colleagues who want to work as a fellow within our society and within our committee. And we're really hoping that our committee will become a main stable of the Cardiothoracic Society, because the three of us always have said, and it's so true, cardiothoracic surgery, thoracic surgery is a team sport. And this is the time that that team really becomes a team with all involved, including nurses, including allied health providers. And I hope that many people find us. And if they have any questions, please feel free to contact either Christina or myself. We're very happy to help you, and we want to become a success. And we're looking forward to the applicants.
Thank you both so much, Richard and Christina, for providing this information. We're really excited that EACTS and AtriCure are making this contribution to nursing science, and hope you get a lot of applications. So thanks so much for being here today, and I look forward to hearing about who the successful candidate is. Thanks so much for being here.
Thank you.